Today, let us discuss about the diagnosis of pregnancy. Diagnosis of pregnancy means, what do you mean by diagnosis of pregnancy? Nothing but to detect the pregnancy or to confirm the pregnancy, right? Whether she is pregnant or not. Why do we really want to check whether she is really pregnant or not? Or why do we really want to confirm the pregnancy? The first and the foremost goals are, three goals are there. Why? Why means to start with the antenatal care. To start with the antenatal care. To avoid, see, if we don't start antenatal care, there is a chances of getting neural tube defects or some disorders, congenital disorders. So if we start antenatal care, there is a less chances of getting congenital disorders. Not only congenital disorders, by starting the antenatal care, many complications or risk factors we can avoid, right? And next one is to advise lifestyle modification. Why the lifestyle modification is required? What do you mean by lifestyle modification? Lifestyle modification is nothing but, in our India, there are less cases of alcoholism and smoking. But if we take consideration universally, the women's also is to take alcohol and also smoke. So in that case, if she is pregnant and she doesn't know she is pregnant, if she continues, there is a chances of getting congenital malformations and alcoholic syndrome in the babies. To avoid that one, it is very important to confirm the pregnancy. And to terminate the pregnancy, termination, what do you mean by terminate? To discontinue the pregnancy. Why do we want it to discontinue the pregnancy? In case of like Down syndrome, in case of Down syndrome or congenital malformations. So in that case, we can terminate the pregnancy in early stage. Otherwise, if she got 20 weeks of gestation or 20 weeks of pregnancy, then only she came to know that she is a pregnancy. In that case, to terminate the pregnancy, it is more complicated than the early pregnancy, right? It is complicated to the mother as well as to the, okay, if we really wanted to terminate, baby side we won't look over, right? However, we are going to discontinue the pregnancy, but mother side we check for the safety of the mother. It is very important to know or to confirm the pregnancy in the early stage, to start with the antenatal care and to modify the lifestyle and to terminate the complicated pregnancies or unwanted pregnancies. How can we confirm the pregnancy? By using the three parameters. Physical examination. Physical examination is nothing but all the signs and symptoms of pregnancy. There are three signs and symptoms of pregnancy. What are they? Presumptive signs, prodromal signs and positive signs. Depending upon that, we can confirm the patient or particular woman is pregnant. Those all the signs comes under the physical examination. And laboratory tests. Under this laboratory test, HCG, or you can write HCG. What do you mean by HCG? Human chorionic gonadotropin hormone. I explained you that in the initial stage of the pregnancy, human chorionic gonadotropin is released by the chorionic villi. This presents in the blood of the woman. Even the serum of the woman, it contains, and also urine. Through the urine also, whatever the excessive amount of the HCG hormone is there, that will be washed away or filtered away by the kidneys, so that we can check the blood test for HCG. blood test for the HCG to confirm the pregnancy, and also UPT, urine pregnancy test. Urine pregnancy test we can do in the home itself, but whereas blood test will have to go for the laboratory to carry out the test. These two tests are to confirm the pregnancy, and another test is USG, ultrasonography. Ultrasonography. Through the ultrasonography we can visualize the fetal yolk sac. We can visualize the fetal yolk sac in the uterus to confirm the pregnancy. These are all the main three tests that carried out by the doctors or medical persons to confirm the pregnancy. Now pregnancy is confirmed. After confirmation of pregnancy, what next we have to do? Antenatal care. So, what is the purpose of giving antenatal care? Aim. What is the aim of antenatal care or goal of antenatal care? There are some goals to carry out the pregnant and the pregnant woman. What are like goals? Let us see one by one. To promote or protect, the health of the pregnant woman. During the pregnant time, it is our responsibility as a part of the antenatal care to protect and to promote the pregnant woman's health throughout the pregnancy. And next one is to have term pregnancy, to have full-term pregnancy, to continue full-term pregnancy and have normal delivery. What do you mean by full-term pregnancy? I already explained you. The 36 weeks of gestation or 40 weeks of gestation is called as full-term pregnancy. If in between the mother delivers, that is called as preterm delivery. Okay. And next goal is to identify the risk factors. To identify high risk pregnancy. Remember that high risk pregnancy. High risk pregnancy. What do you mean by high risk pregnancy? High risk pregnancies are like pregnancy-induced hypertension. Pregnancy-induced hypertension. For example, PIH. We can say as PIH. Example is PIH. What do you mean by pregnancy-induced hypertension? During the time of carrying, some people, there is a chances of getting hypertension because of hormonal changes or like because of sedentary lifestyle or because of family history. So, if we identify such cases, there we can reduce the maternal mortality rates and infant mortality rates. And to reduce the maternal mortality rate MMR or infant mortality rate IMR, maternal mortality rate and infant mortality rate we can reduce if we could identify the high risk pregnancy during the antenatal stage. Next one is to identify the complications. Pregnancy complications. What are the pregnancy complications? Are placenta previa. Placenta previa means the placenta is attached near to the cervical opening. So there is a chances of detaching of this cervix and this placenta, by that it leads to the abortion. Such complications we can assess during the antenatal period. Is to identify the psychological changes in the pregnant woman. To identify psychological stress disorders. Some pregnant women being tortured by the husband or in-laws, if they get pregnancy, they feel that it is not the correct time. depressive, anxiety. These are all the conditions we can identify during the antenatal period and give some counseling to get away from psychological depressions and disease conditions. Next one is to educate. To educate mother to take care of baby after delivery, how she has to take care of the baby. We can educate the mother even she is during the time of pregnancy only. By that she can prepare her mind to educate the mother to how to take care of the baby, to how to meet the nutritional needs, how to feed him, how to feed the baby, to hold the baby. These are all the things we can educate during the antenatal period. Advice. To advise about family planning. To advise about family planning. Why do we really want to advise about the family planning? Even she didn't even deliver her baby. Why means some people immediately after delivery, within 3 months or 6 months, they conceive baby. Outside baby, delivered baby is just 6 months and inside baby is 2 months. This is very difficult to take care. Even mother, she does like have difficulties to take care of the baby out and inside of the baby. She cannot meet the nutritional needs of the outside baby and the inside baby. And mother's body is not got ready. See, when we plant the seeds, when we sow the seeds, we make sure that there is a sufficient distance between plant to plant. Remember, it is the best example, right? If there is a less gap, what is happening? The growth of both the plants are affected, right? They cannot grow sufficiently because their roots are clumsy and they are not getting enough nutrition because they cannot distribute the nutrition in between them. The same thing happens in the human's life also. We should maintain at least 2 to 3 years according to the WHO. Between baby to baby gap should be 2 to 3 years gap should be there, right? So to reach that one, we can educate both the parents or both the couples about the family planning to maintain. So we came to know mother is pregnancy, right? So we discussed about all the antenatal cares. So before giving antenatal care, what we have to do? We should know the history of the antenatal mother, a pregnant woman. So to know the antenatal mother's history, we have to collect the history of the pregnant woman. So we all know how to collect the history of the normal patients, right? We all know how to collect the history of the normal patients. What are the things that involve? Let us see that one by one. So antenatal history collection. In antenatal history collection, there is terminology that we use GTPAL. GTPAL. G for gravida. G for gravida. T for term pregnancy. And P for premature. A for abortion. L for live births. G for gravida. T for term pregnancy. P for premature. A for abortion. L for live births. Gravida. Gravida means being pregnant. How many times she got pregnancy? That is called as gravida. In other terminology, primigravida. Primigravida means for the first time she conceived. That is called as primigravida. Another terminology is multigravida. Multigravida means for multiple pregnancies she got. Multiple pregnancies she got. Primigravida, multigravida. What do you mean by term pregnancy? If the mother carried the pregnancy for 36 weeks or above, that is called as term pregnancy. If she delivered before 36 weeks, she delivered, that is called as premature delivery or preterm delivery. If mother delivered baby before 36 weeks, that is called as premature delivery or preterm delivery. If she delivered after achieving 36 weeks of gestational age, that is called as term pregnancy. And abortion. Abortion is nothing but discontinue of pregnancy. Discontinue of pregnancy and expulsion of fetus before 26 weeks. Before 26 weeks. Why I say before 26 weeks? If baby delivers after 26 weeks, baby can survive. That terminology is called as viability. I already teach you as per my remembrance, right? Viability means the baby delivers, means baby can survive out of the uterus, out of the environment of the uterus. Baby can survive out of the uterus after she reaches or after baby reaches 26 weeks. Before 26 weeks, if baby delivers, there are very less chances of surviving out of the uterus because baby's lungs and the vital organs maturity is less. Vital organs maturity is less. So, if the baby is kept in the incubators, then baby can survive and come out healthy. Understood? So, abortion is nothing but the discontinue of pregnancy or expulsion of fetus before the fetus reaches 26 weeks of gestational age. Next one is live births. Live births. Live births means the pregnant woman, how many live births she gave, how many number of live births she gave, or living children. We can call it as presently living children. Presently living children. Number of presently living children. These are the main terminology. This code we use to diagnosis the pregnant woman. I will explain you in detail also. Okay, gravida, term pregnancy, preterm pregnancy, abortion and live babies. Now let us see the example here. A diagnosis of antenatal mother. G2, T1, P0, A0 and L1. G2, second pregnancy. She is for the second time she got pregnancy. Second pregnancy. This is her second pregnancy. And T1, term pregnancy. One pregnancy she got termed, but this second pregnancy is just for 26 weeks. She visited the hospital at her 26 weeks. So we can write only one term pregnancy, right? Last pregnancy she reached 36 weeks, but this pregnancy she is just running 26 weeks. So G2, T1, P1, preterm or premature deliveries. Premature deliveries are not there, 0. Abortions, nil, 0. Live baby. Whatever she termed pregnancy, she delivered and she have a one living baby. Understood this description? G2, second time pregnancy, running 26 weeks. T1, term pregnancy, last pregnancy. After term only, after reaching 36 weeks only she got delivered. So she got one living baby, but premature deliveries or preterm deliveries are, abortions are 0, right? Still now we discussed how to write a diagnosis for the antenatal mother. So GTPAN. Now it is a task for you students. Write down now third time pregnancy and one living baby and one abortion after 27 weeks. 27 weeks of gestation. But for terminology purpose, abortion we can write here. Write down the diagnosis and